For those people who have joined in, just if you have questions, you can start typing when we are doing the slides, and yeah, we'll go in order. So first come, first serve. So just if you have any questions as we go along, you can type them in the chat, and we can go through them once we finish the presentation. From Day to talk about this hot topic, the microbiome. It's definitely a hot topic in fertility now, and there's a lot of research going into it. There's a lot of effort being put into it because it is the new frontier. I do believe that this vaginal microbiome, uterine microbiome, seminal microbiome has a role to play in fertility and pregnancy, that we are only kind of at the tip of the iceberg now, and in future we will learn a lot more and be able to use this to the benefit of many patients in the future. But today we just want to go through a little bit about the vaginal microbiome and also the effect of it on fertility, and then STIs and HPV as well. So the vaginal microbiome is the balance between healthy bacteria and microorganisms and unhealthy bacteria and microorganisms, and we have this in almost pretty much every system. It was initially studied most in the gastrointestinal system, in the gut, because that's where we have the most bacteria. But we're finding that we have microbiome in pretty much everywhere, including in the reproductive tract. When I was in medical school, I was taught that the uterus was sterile, but we're learning actually this is not the case. And there are balances of healthy bacteria that should be there, which are then helpful for the woman in terms of her outcome for pregnancy and fertility. So it does play a role in reproductive health. Exactly what the microbiome needs to be, how to treat, how to test, these are things that we are learning. So we're still at very, very early stages, but each year there are new tests, new treatments, new techniques, better understanding, more studies that show the impact. So we're certainly learning quite quickly, but yeah, these things do take a bit of time before we fully understand them. And the benefit of the vaginal microbiome being healthy is that it maintains a balanced environment. So there will be less risk for this woman to have harmful microorganisms that can cause damage to her health or even to the pregnancy if she's pregnant. So yeah, imbalances can lead to infections, infertility, and even complications in pregnancy, even late pregnancy, and even after delivering the baby, short period after delivering the baby as well. So there are certain bacteria which are important for maintaining healthy bacteria. The most famous, the most important one is the lactobacillus, or lactobacilli as a group. And the more lactobacillus you have, the more protected you are. There are other bacteria, such as bacterial groups such as bifidobacterium, for example, which we also know is beneficial. But lactobacillus is the one that has been most researched and most understood. And we would like to see the vaginal microbiome dominant in this, because when there's a lot of lactobacillus, there will be lactic acid produced, which reduces the pH in the vagina. The ideal pH for the vagina is between 3.5 to 4.5, so it's a slightly acidic environment. And when this environment is maintained, there's less ability for things like bacteria that cause BV, like Gardnerella or other bacteria, Prevotella, to grow, which can then cause harm. And also it's favorable for the sperm as well. So this is also linked to fertility, as not just for the woman's health, and also risk of ascending infection in pregnancy, which can then lead to complications like preterm labor or premature rupture of the membranes or other complications in the pregnancy that could be avoided by maintaining a healthy vaginal environment. So lactobacillus, bifidobacterium, and there may be others that we will discover as we go along. These are important policemen, if you like, or helpers that will keep these bad guys under control. So STIs, there are some STIs which are very famous and are quite common, especially chlamydia and gonorrhea. There are of course, many others. Some are viruses, these are bacteria, some are viruses, some are fungal, some are parasitic. But the chlamydia and gonorrhea, they are well known to cause pelvic inflammatory disease, or PID. And this PID is an issue for fertility because it can cause scarring. So the inflammation that happens can cause scarring inside the abdomen. It can cause damage to the fallopian tubes, inflammation in that area. And this can then, a lot of the time, lead to blocked fallopian tubes, meaning that the sperm and the egg can't meet, or it's very difficult for them to meet, or the risk of an ectopic pregnancy will be higher because of that tube being damaged. And these two bacteria are really famous for damaging fallopian tubes. And as a gynecologist, I've seen a lot of this in some young women who had these STIs and then ended up getting pregnant, ending up with ectopic pregnancies, sometimes having to have one or even both tubes removed as a result of this STI, or even just causing problems with the tube, swelling in the tube with fluid, which we call hydrosalpinx, which is also going to affect significantly the woman's fertility. So definitely these have a big impact. So the sooner that you pick them up, the better. Problem is, a lot of the time, they are causing very little symptoms or sometimes no symptoms in the woman. So she doesn't even know that this is going on, or it's just very mild tummy ache and she puts it to something else. And therefore treatment isn't given, and then by the time it's discovered, it's way too late. So yeah, especially the chlamydia quite often is asymptomatic, but the long-term effect is permanent. So the tubes will be blocked and there's a risk of ectopic pregnancy. Gonorrhea the same. Herpes, which is a virus, this can also affect the reproductive health because it causes inflammation, but also it's important around the time of delivering the baby, because if there is a new herpes picked up at the time of delivering the baby especially, or even if it's a recurrence that can happen at the time of delivering the baby, this can then be transmitted to the baby during birth if the woman goes for a vaginal delivery. So sometimes the decision is made at that time not to go for a vaginal birth, and a cesarean section may be done, which has its own risks and problems. So it's something that can impact the woman's health and the baby's health even. And then there are some other infections such as ureaplasma and mycoplasma. Mycoplasma and ureaplasma can live in the vagina in small amounts and not cause too much harm, but when they overgrow, when there's too much of them, then again it can affect implantation, it can cause miscarriages, and it can lead to other complications in pregnancy as well. So these are things which are also quite important to know about, and quite often asymptomatic is the other problem. Herpes is the one that actually causes symptoms, so anyone who has had herpes will know it's a very uncomfortable situation, especially the first time it comes. It causes a lot of pain, and even with the occurrences, it can cause a lot of painful ulcers. We then come to HPV, so human papillomavirus. When I was at medical school, the relevance of this was mostly told to us to be causing warts, genital warts, which wasn't really too serious. But since then, we've learnt that there are certain strains of this HPV virus which can cause cervical cancer. So if you do have these strains, then there's a much higher risk of developing cervical cancer, and especially 16 and 18, if these two together in fact account for about 70% of cervical cancer. So there has been a vaccine which has come out now and which is being given to girls, which is protective against these two strains. There's another vaccine which can be given, it's given in some countries, which doesn't have just these two strains but has 4 strains of HPV. But actually the ones that cause cancer are more than even 4. So I don't think we're going to get rid of it completely, even with the vaccination. And cervical smears are going to stay for a long time. And even the smear test has changed, since I was at medical school, where we used to look at the cytology, we used to look at the cells. When we do a smear now, it's actually the first step is to check for HPV. Is it positive or negative? If it's negative, that's it. They don't even look at the cells. The sample is thrown away. If it's positive, then they'll check the cells and see if there's any abnormality found. So the significance of a virus on cancer is, it cannot be underestimated really as to how big an effect it has. Now, with regards to fertility, it also has some effects. So if it causes change in the cervix or cancer, then that can affect the cervical mucus. It can even block sperm from coming through the cervix. And then if the woman has had cervical changes or cancer and has treatment, it depends of course on the stage of the cancer, but if it's early enough and the woman is young and still wanting to keep her fertility, then there is fertility sparing surgery, where cervical trachelectomy, where they will cut away as much of the inner part of the cervix as possible, but still leave a little bit of cervix to allow for a woman perhaps to have a baby, and then hysterectomy can be done after that. But the problem with that is it leads to a lot of scarring. It leads to also a very short cervix, which can cause premature rupture of membranes or preterm birth. So it does come with quite a significant risk as well. HPV can trigger an immune response and cause an inflammatory environment, which could interfere with the implantation of the embryo. It can even attach to sperm, and there is, it's very interesting actually how they can join with the sperm DNA and cause damage to it, and that may increase miscarriage rate. Egg quality, we don't think it directly affects the egg quality, at least as far as we know, but it can cause the inflammation that we said, which indirectly could have an effect as well on the egg quality. So yeah, just in summary, the microbiome, STIs, HPV, these all can have effects on the woman's fertility and her female health. So, prevention, awareness, regular screening, this is really, really important to keep the woman in the best state for her reproductive health. And of course, in having the knowledge and knowing about this, the woman can then have informed decisions made, and that will really help her in a fertility journey, and of course also for her general health as well.
I actually learned so much myself, and I have so many questions. Even being a clinician, it's mind-blowing how much we find out as time passes by, and how, and thanks to the research and the ability to get the information. I think I will ask the questions that we received from the patients through our chat. We just recently launched a WhatsApp chat on our website, and patients did contact us regarding the microbiome, the infections, and a lot of patients, what surprised me, contacted about the UTI and exactly the impact of having repeated UTI on the microbiome, and then the ability of successful embryo implantation. And I was wondering if we can cover this question, because it happened that so many of us have UTI, and it's so common. So how dreadful is that when you're on your IVF journey?
Yeah, so UTI is, like you say, Maria, it's very, very common, more common in women than men. But the fact is that the UTI it's an infection in the urinary tract, which is not the same as the genital tract, but they are very close by, and they're of course very much linked. And not only that, but also the UTI is typically treated with broad spectrum antibiotics like penicillins and cephalosporins, etc., which in turn will affect the woman's whole microbiome, including the genital microbiome. And if there isn't good advice given to people to take probiotics alongside their antibiotics, which still isn't the case, unfortunately. It should be that if you're given a course of antibiotics, you're also told, okay, you need to take some probiotics as well with this, and continue the probiotics even after finishing the course of antibiotics to try and replenish the good bacteria that you've just destroyed, because the antibiotic, especially broad spectrum antibiotics, will be like taking a machine gun out and just shooting everyone. And you want to rebuild that good bacteria so that you have that good microbiome, which will create a good, healthy environment for the pregnancy and for that woman's health in general. So yes, UTI is a difficult one. Also, some women, unfortunately, the reason women get more than men UTI is because the urethra, the tube which comes from the bladder outside to the body, is short, it's wide, and it's quite straight. Whereas in the man, it's long, it's thin, and it's torted. So it's much easier for bacteria to come from the outside into the bladder compared to the man. Now the problem also is that some women, when they have intercourse, which of course couples who are trying for a baby will be having lots of, hopefully, that in itself sometimes can trigger UTIs, and it's a bit of a tricky situation, because a lot of the time these women are given long-term antibiotics, or prophylactic antibiotics. Yes, and they're a smaller dose, but still that will have an impact on the microbiome, especially if the woman isn't using probiotics alongside that, which surprisingly many times isn't the case. So yes, you have to have the UTI treated, because the last thing you want is to leave that UTI to progress and then become probably kidney infection and then sepsis, and this is something which can start off very small but end up dangerous and causing significant health problems. So definitely the UTI needs to be treated, and the treatment is antibiotics for it, but it's important to couple that with probiotics to cover for the fact that you're also going to be losing some of the good bacteria that you want to keep.
Thank you so much, Dr. Sami. We just have a few questions, and actually I can see myself in the same situation. So lady messaged that if she had HPV and she had treatment several times, but it keeps coming back. Would this be harmful to her fertility in the future?
Yeah. So yes, I mean, definitely HPV is not desirable. You want to try and be free of it as much as you can. Usually with time, the immune system will clear out the HPV. So this is most commonly what happens. And even for women who have HPV and they have their smear test and it picks up the HPV, they check the cells, they may do a colposcopy. If everything looks good, then they're told, okay, just we'll repeat in 6 months or a year. And most of the time, actually, the HPV will clear on its own because the immune system has managed to get rid of it. But of course, there are people who cannot clear it or have difficulty clearing it. Someone who has a weakened immune system, for example. Or another one, which is a bit topical for what we're talking about today, is if you have a co-infection. So if you have, for example, chlamydia or gonorrhea, which hasn't been picked up because they've just screened for HPV, they haven't screened for everything. That in itself can make it harder to clear the HPV. And then, as Valentina mentioned, the vaccine. If you keep getting the HPV, you can look into getting vaccine for you and for your partner. If you're, under 45, then this is a good option as well to try and help. With the vaccine in the UK, it started off with the vaccine just covering 2 HPV types, and then it became 4, and it was initially given to girls until 2019 when they said, okay, we're just vaccinating half the population here, we're not going to get rid of this HPV that way. So only since 2019 have boys between the age of 12 and 13 been offered the vaccine. But of course, boys who are 14 or 15 at the time, they missed out, and similar to girls who before they started the HPV vaccine. So this means that there is still a chance that the man can have HPV, and HPV is difficult for the man to get diagnosed. There are only very few centers, specialized centers, where you can get HPV testing for a man. It is possible, it's very tricky to obtain. It's still not widespread, unlike for women, where it's quite easy to get now, and even through the day you can do it now at home. So this is a problem, and it will affect fertility indirectly. It can affect the sperm, like we mentioned, but also it can affect the cervix, and there are effects which are indirect towards someone's fertility. So HPV, you need to focus on it and maybe get yourself checked and make sure there's no co-infection. Get the microbiome in good shape, so test your microbiome, see if you need to have any extra probiotics and any antibiotics to fix that. And then hopefully your immune system will take care of it and it will go away, and then that will be better for you.
Thank you so much, Dr. Sami. And another very good question, and I can see that Valentina has already answered, but I just wanted to mention that at Plan Your Baby, we do test quite a lot for microbiome, and during the preparation for IVF cycle, or when we identify low, for example, lactobacillus cells. So, Dr. Sami, how often would you recommend to retest vaginal microbiome, especially when you identify the problem and then you prescribe treatment, probiotics, or anything else?
Yeah, so if we've tested someone to check if their microbiome is in good shape, sometimes it's fine, and we just reassure the woman and say, okay, this looks good, and just try and maintain your healthy diet and lifestyle, and if you're taking some oral probiotics, keep going. Because we didn't really talk about this, but there are things that you can do to help your microbiome without drugs. So definitely diet is important. Looking to see what are prebiotic foods and probiotic foods. Make sure you have lots of fiber in your diet, because if you have a good gut microbiome, that also will translate to the reproductive tract as well. And then if we do find that there is a need to treat, sometimes it's just treating with probiotics. Sometimes I give the probiotic vaginally as well as orally. Sometimes also it can be that we need antibiotics. And then if we want to recheck, normally we will recheck 6 to 8 weeks later to see how things have changed and hopefully improved. But yeah, definitely the advice stands that you need to focus also on your diet and improve the gut microbiome. And for the vagina, avoiding things like douching, harsh soaps, or unnecessary antibiotics. So, if antibiotic needs to be given, then you need to take it, of course. But sometimes there is a little bit too free a use of antibiotics, especially broad spectrum, which can have some other effects which are not good, and it can affect the microbiome of the genital tract as well.
Thank you so much. And another question that I also received through the inquiry, in pregnancy. So do we recommend to check a vaginal microbiome, and how often, and at which stage of the pregnancy would that be, I would say, more crucial to understand if there is any issue with microbiome?
So I don't test at the moment in pregnancy. We try as much as we can to optimize things before pregnancy, and then it's much easier than if you need antibiotics. And sometimes it takes a bit of time as well. It's not ideal to be faced with this in pregnancy. I don't see anything wrong with testing in pregnancy myself.
And just to clarify, so probiotics, because I know we prescribe them and we do advise to take throughout, before embryo transfer, after embryo transfer, just to clarify, so it is safe to take them, isn't it?
Yes, yes.
Because we do hear a lot, because we change medications after embryo transfer and we adjust the protocol, and of course it's very different from the stimulation phase and post embryo transfer. So, and when patients do take probiotics, the main question appears: can I continue taking them, and how safe it is, which is safe. And another way.
Can I just add one thing about pregnancy though? So when a woman is pregnant, there are quite a lot of hormone changes, and one of the changes is that the estrogen levels will become quite high. Now that's good, because estrogen increases the amount of glycogen in the vagina, and glycogen is the food for the lactobacillus. So a lot of the time there will be an increase in lactobacillus just because of the pregnancy changes. This is probably a physiological change to protect the woman, and yes, so this is a good thing that even on its own, just the pregnancy itself can actually improve the woman's microbiome without even any treatment.
And another question: so does hormonal birth control affect the vaginal microbiome? I don't know the answer, so this is extremely interesting. Either it still hasn't been discovered, or is there an answer to this?
Contraceptive pill, we're talking about combined contraceptive pill, definitely impacts the woman's hormones. And yes, there's some estrogen there, but it's a synthetic estrogen, which probably doesn't have all the same effects as the natural estrogen a woman produces. And even the same with the progesterone, it's a synthetic progesterone as well. So these are not like the changes I just mentioned in pregnancy, which are due to natural hormones being produced. So yes, there will be a change from the oral contraceptive pill, especially if one takes it for a long time. We find that even women with certain conditions like PCOS or endometriosis, they have a different microbiome compared to women who don't have these conditions. So any kind of subset of hormones or reproductive situation will affect the microbiome also.
As the conversation led to what exactly can cause the vaginal microbiome to have an imbalance, I think the question what interests me a lot is the immunology, reproductive immunology, and is there any correlation between immune imbalance and vaginal microbiome? Does the immune cells affect the vaginal microbiome?
So yeah, I mean, the balance is going to be kept by immune cells as well. So if you have pathogenic bacteria, if you have things which could be harmful to the body, then the job of the immune system is to clear that up. The immune system in people, it works different ways. So some people have very active immune systems, some people not so active, some people it's active in ways which can be harmful against your body. So again, if the immune system isn't quite balanced, then that can affect things. But I don't think there's any clear study yet which will tell you that if you have such immune parameters, this is going to have such an effect. Perhaps in the future we will have some studies, at least as not that I've seen. The
reason why I asked, because at Plan Your Baby, so we do specialize in reproductive immunology, and it's happened that unfortunately we don't see any cases, and sometimes patients do come to us after having multiple miscarriages, multiple IVF cycles that failed, and it's really heartbreaking. And in these specific cases, we always recommend vaginal microbiome. It's one of the tests that we started to include as the first line investigation, because very often appear that this never has been tested for them. And I think this is something that maybe in the future we will be able to conduct a lot of information after knowing the medical history and the vaginal microbiome result, were there actually any correlation. that will be very interesting to understand.
Indeed.
Okay, I think we don't have any more questions. I just wanted to mention that we will be publishing the video on the YouTube channel, and we will share the link with everyone who joined and everyone who wanted to join but couldn't. We had a lot of requests, but I guess Friday night is the night to relax and finalize the week. So we'll be in touch with everyone, and we'll be sharing the link. And we will continue sharing all of the insights on the treatments, on the vaginal microbiome impact, what we as a clinic learned a lot through our case studies. So yes, so fingers crossed, and as time passes, we will discover more new solutions for the patients, especially to improve the pregnancy rate and the birth rate.
I think this is a very new field, and it's developing so rapidly. It's really exciting and really interesting to be in it. And yeah, we hope we will learn a lot more and be able to help a lot more people that way.